Hello, I'm Malcolm Herring. I practiced vascular surgery for 32 years, and in that time, I think I've seen medical practice at its very best, and I think I've seen it at its very worst. I know that physicians and staff come into the hospital each day fully intending to do their very best for their patients. But unfortunately, the stresses of the hospital distort their intentions. Some of those distresses are the very frustrations of dealing with the patient's illness. Some of those stresses are business stresses, the economic stresses, the stress of malpractice, the stress of healthcare reform. And some of those stresses are deeply ingrained in physicians by the way physicians are trained. These stresses cause spiritual depletion. Now, nobody comes up to you and says, "Hi, I've got spiritual depletion." You have to listen for the symptoms. And the symptoms sound like this for a physician who's spiritually depleted. He tells you that I've just lost the joy in the practice of medicine. It doesn't do it for me anymore. Or he might say something like, the practice just drains me. Do you think this is something that just happens to a few physicians? Consider the recent American College of Surgeons report that stated 40% of American surgeons are burned out and 30% of American surgeons meet clinical screening criteria for depression. Think of the effects of that on your loved one the next time they have an operation. There's a 30% chance their surgeon will be awash in depression. And what are the effects of depression? Agitation, difficulty thinking, feelings of hopelessness. Imagine how that will affect every one of hundreds of decisions that are made during the course of a single operation. So what are the symptoms of spiritual depletion within the hospital? Well, there's symptoms like poor quality of care, difficult relationships between physicians and staff, unethical practices, high levels of malpractice, patient satisfaction issues, and minimal giving to the hospital financially. Imagine the effect on your bottom line if you could correct any one of these symptoms by 25 to 50%. I wrote The Physician Champion, started this website, and created Physician Formation Consulting to reverse these symptoms, to restore joy in the practice of medicine, and to help physicians all across our country align on the mission of their hospital. It's about expanding our concept of care. It's about developing a culture of mutual care and compassion. I invite you to join me in doing just that. There's contact information on this website.